a few things that I think you should be doing if you have diabetes or prediabetes and you want to improve your blood sugars. And the first 5 may have nothing to do with exercise, but the first thing is definitely setting up those boundaries. So I had a patient and I had access to their continuous glucose monitor remotely. And I was just looking at their blood sugars, just assessing, you know, the information that I saw and how their food impacted their blood sugars and how their workouts were impacting their blood sugars. And I saw on their CGM, the continuous glucose monitor, that their blood sugars were just climbing. And I'm saying to myself, okay, I know they're not eating, I know they're not exercising, what is going on? Did they have a snack? But then I'm looking like, if they had a snack, it shouldn't be so high. So I immediately reached out to this specific client of mine and I mentioned, hey, your blood sugars are like skyrocketing. What in the world are you doing? And she explained to me that she was in a very heated conversation and her blood sugars were responding because, of course, you know, cortisol, fight or flight hormones, you know, coming into play. And so I told her, you know, for better blood sugar balance, as I like to say, it may behoove you to remove yourself from that conversation and just calm down a little bit. I'm a registered dietitian. I am not your dietitian. Let me just put that disclaimer. And I am also not a therapist, so I'm not equipped to handle whatever type of mental duress that you are experiencing. So a therapist, a licensed therapist, can definitely help you because they can give you tools that you can utilize to help you manage that stress if you are unable to set up a boundary. All right, number 2, and you guys may not like that I'm gonna say this, but I'm just gonna say it anyway. I want you to take your prescription medications as prescribed. If we ever work together and you tell me that you wanna get off your medications, baby, that has nothing to do with me. I did not put you on those medications. Your doctor put you on those medications. So who you may need to talk to is your doctor and or pharmacist if you have concerns about your prescription medication. Now I know there may be some keyboard warrior that may say, Kim, but the medications are poisonous and my doctor wants to poison me. Again, that is a conversation that you need to have with your doctor. And I have these webinars, I have these master classes, and I explain in more detail the method to my madness here. So let me just give you like a little snippet. So when you were diagnosed with type 2 diabetes or prediabetes and your doctor may have put you on certain medication, what your doctor is noticing is, okay, because type 2 diabetes is an inflammatory condition, right? So what your doctor is noticing is because of your chronic high blood sugars, your blood sugars needed to come down, and they needed to come down quickly so as not to cause any damage to any other organs. If you do have blood sugar problems, it impacts every single organ inside of your body. Leave nothing to the imagination. It impacts everything from the top of your head to the sole of your feet. And to prevent damage from occurring in these various organs, the medications were employed to help you better manage your blood sugars and reduce that inflammation. And some of these medications can have that impact as well as a protective effect on different organs in the body. Is smoking. Yes, smoking. Just stop. Smoking can make it extremely difficult to control your blood sugars, or let me not say control, manage your blood sugars. You may notice that your blood sugars are high, and that may be attributed to smoking. So just stop. All right, so number 4, movement. Move your body. Please move your body. Try to get at least 30 minutes of movement on a daily basis. 30, that is it. I know some people have told me that they may be wheelchair bound, they may not be able to exercise, they can't use their feet, different things of that nature. So let me say this again, I'm a dietitian. I am not your physical therapist, but I do want you to move your body if you can't walk. So I may say things like, hey, engage in some upper body workouts instead, but I do want you to clear it with your physical therapist to make sure that you are able to do these exercises and it is safe for you. Sleep is an unsung superhero, literally an unsung superhero. So a couple years ago, I had the privilege of speaking with Dr. Amy Bender. At the time, and I spoke to her during the pandemic to think about it. During the time, she worked for the Canadian Olympic team. And I was, she was telling me about her sleep research and how she ensures that the Canadian Olympic team gets their rest in, and really how serious Canada is to make sure that their Olympic team is on their P's and Q's. But I said to her, well, you know what, Dr. Amy Bender, like, my clients are not athletes. My clients are individuals that have, a diagnosis of prediabetes or type 2 diabetes. Like, how is this sleep research beneficial for my clientele? And she was telling me that individuals that have poor quality sleep do have higher blood sugar values, and chronically elevated blood sugar values that reach a certain amount can lead to prediabetes as well as type 2 diabetes. So make sure that you're getting quality sleep. So some things that you may need to do, and also, I'm not a sleep researcher, I'm not a sleep doctor. If you're concerned about your sleep quality, please speak to your doctor so that you can get a referral and get a sleep study done. And they can also give you some effective tips, because I see everyone out here taking melatonin, and sometimes melatonin does not do what it's supposed to do. But some practical things that you may want to consider doing is, hey, stop scrolling about an hour, if not 2 hours before bed. The sixth thing is hydration. Water. A lot of people hydrating with coffee, which is counterproductive. I see a lot of people hydrating with juice, which then shoots their blood sugar up. There is a lack of water consumption, and I get it. The taste of water is mundane. It's stodgy. So if you need to cut some citrus, cut some lemons, cut some limes, add some berries into the water to kind of change the flavor a little bit. If you want to use some flavor enhancers, by all means, do what you got to do so that you can take in more water, because the summer months are coming. And when you're dehydrated, your blood sugar goes up. 6 things that you can employ to help you achieve better blood sugar balance. And the 7th, let me just go ahead. 7th, lucky number 7. See a registered dietitian nutritionist. Please, at least once in your, if you have a diagnosis of pre-diabetes or type 2 diabetes and you have not seen a registered dietitian nutritionist, why? As usual, thank you for watching. Remember to comment, like, subscribe, and share. And if you have any questions, let me know in the comment section below. Bye-bye.